Hi friends, good evening. Welcome to my channel. Friends, through my channel daily we are seeing important points for exam. Today's topic is from community section. So first point we will see, first is birth rate. The number of live birth during a year per 1000 estimated mid-year population, that is birth rate. That is number of live birth during that particular year divided by estimated mid-year population into 1000. That is called the birth rate. Okay, death rate means number of death per 1000 estimated mid-year population in 1 year. That is number of death in an year, in a particular year divided by estimated mid-year population into 1000. That is called death rate, birth rate and death rate. And next we will see maternal mortality rate. Maternal mortality rate means total number of maternal death during antenatal period, intranatal period or postnatal period due to pregnancy related problem in a year, in a particular year per 1 lakh live birth in the same year. That is the number of maternal death due to pregnancy or childbirth and occurrence during pregnancy or within 42 days of delivery divided by total live birth in the year into 1 lakh population. That is maternal mortality rate. And next important point, Vaccination Act was passed in 1880. And next one, measles vaccine was discovered in 1960. And BCG vaccine was discovered in 1921. And tuberculin test was discovered by von Precute in 1907. And next important point, first vaccine was discovered by Edward Jenner. And the first vaccine to be discovered was smallpox vaccine. Edward Jenner discovered by smallpox vaccine. And Pinda is a skin lesion caused by Treponema cariatum. And Guma is a lesion associated with syphilis. It's a cancerous lesion, occurs in tertiary stage of syphilis. And John Snow is the father of epidemiology. And anthracosis is caused by accumulation of coal dust or carbon. And bagosis is an airborne disease caused by inhalation of cane sugar residue. And next point, Vaginosis is caused by exposure to cotton dust. So, exposure to cotton dust will cause vaginosis. And rubella in the first trimester cause heart malformation. So, if a lady is pregnant and in first trimester, if she is getting rubella, it may cause heart malformation to fetus. And Still's disease is also known as atrophic arthritis. So, atrophic arthritis is known as Still's disease. And the very next point, one subcenter covers a population of 5,000 in plain areas and 3,000 population in hilly or tribal areas. That is one subcenter. And one community health center covers a population of 1,20,000 in plain areas and 80,000 population in hilly or tribal areas. One community health center, 1,20,000 in plain area, 80,000 population in tribal or hilly areas. And one primary health center PHC covers a population of 30,000 in plain areas. In plain areas 30,000 population and 20,000 population in hilly or tribal areas. In hilly or tribal areas it is 20,000 population. And the heart of ICDS scheme is Anganwadi workers, Integrated Child Development Scheme. And the full form of ASHA is Accredited Social Health Activisit. That is the full form of ASHA. And next is primary case. Primary case and index case. Primary case means first case of communicable disease introduced into the population. That is, firstly the case occurring in a particular area is called primary case. And the index case means first case that came into notice of an investigator. Particular health person is seeing the person is having communicable disease. That is index case. Primary case means first case of communicable disease. And next point, eligible couple means currently married couple with a wife in reproductive age group, that is 15 to 45 years. This is an important question. I saw in question paper what is the age group of eligible couple. The age group of eligible couple is 15 to 45 years. And the causative organism of rubella is toga virus. It is an RNA virus. And the incubation period of rubella is 2 to 3 weeks. And the very next point, the causative organism of Kala Azar is Leishmania donovani. And the incubation period of Kala Azar is 1 to 4 months. And the next point, causative organism of Q fever is Coxella brunetti. And the incubation period of Q fever is 2 to 3 months. This is also an important point, both causative organism and incubation period. Next important point, National Rural Health Mission was launched in 2005 and National Health Mission in 2013, NRHM 2005 and National Health Mission NHM 2013. And relaxing fever is caused by Borrelia recurrens and trench fever is caused by Rickettsia quintana. These causative organisms are important. Any one causative organism can expect that, and also the years are also important. Okay, and epidemic typhus is caused by Rickettsia prowazki. Epidemic typhus, these are all lice-borne disease. Okay, World Hepatitis Day is July 28 and Alzheimer's Day is September 21 and Hiroshima Day is August 6 and Nagasaki Day is August 9. Hiroshima Day is August 6 and Nagasaki Day is August 9 and Hemophilia Day is April 17 and Anganwadi Workers Day is March 9. And next point, 1 gram of protein gives 4.4 kilocalorie, that is 17 kilojoule, and 1 gram of carbohydrate gives 4 kilocalorie, same, that is 17 kilojoule. That is protein and carbohydrate will give 4 kilocalorie. And 1 gram of fat gives 9 kilocalorie, that is 37 kilojoule. Calorie and kilojoule both are important. Maybe question from will ask like kilojoule. Okay, and in a balanced diet 60 to 70% of total energy intake should be made by carbohydrate. So most of the energy we are getting through carbohydrate, and 20 to 30% of total energy intake should be made by fat. Next important factor is fat, and 7 to 15% of total energy intake should be made by protein. And protein, third factor. And 1 gram of hemoglobin contain 3.4 milligram of iron. Okay, and the very next point, iron is mostly absorbed from duodenum. Mostly iron absorption occurs in duodenum is an important question. So, and upper small intestine in the ferrous form, it is occurring upper small intestine. And during pregnancy, woman requires additional 300 kilocalorie per day as per WHO, that is 300 kilocalorie per day, and lactation it is 550 kilocalorie per day.